Hello, my name is Jesse, and I'm a therapist who uses Brainspotting. I'm going to talk a little bit today about what it's like to be in a Brainspotting session. So the first thing that we usually do in Brainspotting Therapy is identify what the issue of focus will be. This issue, sometimes folks come into the therapy session knowing already what they want to talk about or what they want to focus on in the session. Other times it's not so easy, and the therapist can support you in identifying something that will be helpful to focus on during the time together. This could be a recurrent thought pattern, a memory. It could be a past experience of abuse or something really tough that you've experienced recently. Whatever the issue of focus is, we identify that, and that's what we use to anchor our session. So once we've identified the issue of focus, then we explore your activation level around that memory or experience or sensation. And oftentimes you'll be encouraged to raise your activation level if possible, so that we can really be present with that experience together in a safe environment with compassion. We rate your level of distress on a scale of 0 to 10, and we want to get that activation level around a 7 or an 8, depending on the situation. So once we have our activation level, we're going to work on finding where in the body is responding to this experience, memory, or a trauma. We can do a body scan or just be curious about what our body is experiencing in the moment as we think through or talk through the issue of focus. Once we identify that part of our body, which can be difficult sometimes, not everyone can do it, and if you can't, that's okay. Oftentimes, I will encourage folks to just follow their intuition, because we're usually not used to being connected with our bodies in this culture. And once we find that, we get curious about that part of our body. Now the next part is usually finding our brain spot, or finding an eye position that connects with that part in our body and also that memory experience or trauma that we're working with. We find a position where we're looking in our field of vision to find a position that connects with that sensation. And so once we've found our issue of focus, we've found our part of the body that's connected with that, and then we found a relevant eye position that helps us access, we will begin the process of focused mindfulness to process the trauma. And this can take several minutes. It can take tens of minutes. It can take longer or shorter, depending on the individual. And this is something that your therapist will help guide you through. Frequently, we'll invite you to engage with the sensations you experience with curiosity and non-judgment. Sometimes the therapist doesn't talk much at all. Other times the therapist will talk to try to help you through some difficult experiences as you process through some of these memories and different things associated with the issue of focus. You'd be surprised what comes up when you just start mindfully focusing on these things. Towards the end of the session, the therapist will likely check in with you about your activation level. Frequently, the activation level will be substantially different than it was when we started. A lot of times it will be quite a bit lower. If it started at a 6 or a 7, it might be at a 1 or a 2. Sometimes it can even get to a 0, and ideally that's where we'd like to help everyone get to with these distressing memories and thoughts and feelings. Now, of course, there are many other ways to approach using brain spotting. In fact, there are many ways that I don't even yet know. I haven't been trained on yet. And everyone has their own unique approach to it, but they tend to follow that similar pattern that I just outlined of first finding an issue of focus, and then getting the activation level up, identifying where it is in the body, connecting that to an eye spot, a gaze spot, a brain spot in some way, and then engaging in the work of engaging with the trauma with curiosity and non-judgment. Well, thank you for being with me in this video, and I look forward to connecting with you in the future. If you'd like to reach out, if you have any more questions about brain spotting, anything like that, feel free to reach out. You can visit my website, and all of my contact information is there. Thank you.